Oh, we have to do
So talking about our ED, talking about our weight problem, 3-hour waits, right?
Right.
And we decided that our triage nurses are the main cause of this,
Right.
correct?
That's right.
So we'll start over here. Tell me what acronym you used.
PCA. PDCA.
PDCA. P, D, CA, this is the quality acronym that we chose. So the P stands for
Plan.
plan. Plan. What are we planning?
Like how to make the situation a little more easier, what to do.
Okay, but more specifically.
So we have a workflow sheet.
So we're planning how to fix workflow
With the triage.
with the triage
The
nurses.
triage nurses are gonna have their own workflow sheet, their own.
So we're planning workflow, okay, of triage nurses. Because we said the issue was efficiency, right? All right, I'm with you so far. Is that the only thing?
Yeah.
Equipment,
And supplies, they need to have them in place.
So we're planning
make sure it's running properly.
equipment and supplies. Okay, anything else?
Communication.
Communication between the registration and the triage.
Communication. These are all things that we're planning.
Uh-huh.
All right, anything else?
And we also need to make sure that we have enough triage nurses scheduled for
So
the time.
staffing.
Staffing.
So when the most patients are in the hospital, we have enough staff.
Staffing plan. What else? That's it?
That's all we have.
All right, so the D
Does it do?
is the do. What are we gonna do?
We're gonna implement and train our staff.
Implement
Well,
what?
we're implement, excuse me?
We're implementing,
We're implementing the plan, everything that we have, we're gonna implement the training.
You have to train them to use their workflow sheets. You have to train them to.
so training is our do.
Okay.
Yeah.
Okay.
You have to train them to put the equipment back where it is and make sure their supplies are stocked.
What else do we have under do? Is that it? Just training of all this stuff? Okay.
And the
See?
Check.
check.
Check. How are we gonna check what we're doing? This was important.
Right.
Well, we're gonna have a check sheet.
So we have a check sheet.
Yes, where we're timing when the patient comes in and is registered to the end of triage.
Okay.
That's when their time ends, that
So we have
time
a check
ends.
sheet for triage.
And that's gonna help us measure whether the triage nursing department has become more efficient if the time goes down.
Okay. Anything else? Well, that's it. Just, we're gonna go with the check sheet. A,
That's when our
That's
data
the,
sheet.
that's the same thing, the
Oh.
data sheet and the check sheet are from the data collection, that's how you know if your plan
Right.
is successful. Whether the time goes
Up
down,
or down, that's how we can.
we can measure if our plan was successful.
okay.
Why you
So that's
looking
A?
like?
Yeah.
A is the measure.
A is act.
Right.
The act. You're checking to see if that act, everything, all the actions that you've taken
Or the
are
measure.
successful or not. If the wait times go down, then it was successful. If the wait times go up, then you need to go back to your plan and redo it.
I think-
Are we not understanding act or something?
I'm thinking the check sheet would be the act and the act would be, I don't know.
Tell me.
Because
She confused me with her facial look, like, she
I know,
like
like, what?
That's what started me off, like, no.
The measurement would be what
The act is, here you have the check sheet. Depending on what the check sheet is going to determine your act.
That's what I thought, uh-huh.
If your check sheet reflects that nothing has changed, then your act needs to be.
Go back to
Right,
plan,
right.
go back to the
You might
plan.
need to go back to, and it depends.
Right.
You may have to go all the way back to the beginning, you may have to go here and do more training or do something else.
Uh-huh.
Or you may need
Okay,
to
okay.
collect your data differently.
Okay,
So act should be a number of different scenarios.
okay.
Oh,
Now,
okay,
if-
that one.
If your check sheet reflects that you're doing better, your act might still be what?
To
Just
maintain.
Maintain.
CPI, right? Continuous process improvement.
Okay.
So even if your check sheet reflects that you're getting better, you're becoming more efficient, our act isn't to stop.
Right.
Okay.
We still want to improve and make it even better.
Okay.
Okay.
But were we on the right track?
Yes.
Okay. Okay. Cause you was looking like,
Yeah,
what?
but that's what them.
You were on the right track, but I was trying to get you to be confident in what you were
okay.
explaining.
But your facial expression was like, really?
Oh, don't worry about my face. All
Well,
right, so we're done here, right?
Uh-huh.
All right, that was pretty good. We'll start a new sheet for another group. All right, what we have?
We did the Six Sigma.
Six Sigma. Okay.
And it's D for defined. And for our definition, it was, on that one you have to.
But what's your acronym?
Oh, DMA.
There we go. That's what I was looking for. So D is defined. What are we defining?
The 3-hour wait time.
Okay.
Um,
You gotta wait.
we're trying to decrease it.
Term and due date within a month.
To make the wait time go down. This is still in our definition
Okay.
area.
1 month.
Our time frame is to give ourselves a month to get it to go down.
And
And it shouldn't be no more than an hour wait in our.
You want an hour wait.
Mhm.
Okay.
That's part of our, including our improvements in the define.
Okay.
And then the way we measured it.
So M is measure.
Yeah, no, I'm sorry.
Yeah, how are we gonna measure this?
We decided to make a chart, and same with, like theirs, it's basically a checklist
So a checklist.
with the person being seen and triaged within the 10 minutes of arriving.
10 minutes.
Yeah,
like, soon as they arrive, they
That's ambitious.
yeah. Because why it should take so long for you to see what's wrong with the person?
I mean,
Then you
it's
go
not
back and you
actually
sit
go
down
into the
talking.
back, but 10 minutes within
To
your
triage
arrival to
nurse.
triage nurse.
Yeah,
You're talking about from
I wish that had
registration
been
to
in
the
real life.
triage
Yeah.
nurse,
Yeah.
10 minutes.
yeah.
Hey,
Window.
this is, if they wanna be
I'm
ambitious, I'm okay with that. All right.
And then,
And then within that 10-minute frame, once they're in the triage, we say that they should at least take a 15-minute time frame with these people to find out what's going on with them. And that's gonna be on our checklist. Did this person stay in this area within that 15-minute range? With that 10 minutes and 15 minutes, that's already 20 minutes of the person's time in the wait room. And then we also said in our track, we wanna see within that 40 minutes left, are they in the back?
with the
Okay,
doctor.
With the back, the doctor. That's part of our measuring part of it.
Okay.
And then A was analyze it. And the way we decided to analyze, we said we're gonna use somebody to sit and actually use a clock and see if these people are doing what they're supposed to do in that chart that we're using to measure.
So you're gonna use an actual
Person.
timekeeper.
Yes.
Okay, let's stop there though.
Okay.
Because that kind of goes here.
Okay.
Analyze would be, what are you going to do
Like
with that
daily.
information?
We're gonna measure them daily for a month.
Create flow charts.
That's measured. But
No,
what,
with the flow chart. I'm talking about flow chart for analyze.
so analyze is not this, then
Create.
the analyze is your flow chart.
Yeah, create chart.
Okay.
charts
Oh, yeah.
For
daily.
days.
Yeah.
with wait times
Flow chart.
and then monthly average.
I'm sorry, you said a monthly average?
Daily and then
Daily.
average and monthly, and see where your improvement is.
Okay.
in flow charts.
Anything else under analyze? Okay.
Next one's improve.
Improve.
I'm gonna put to see if they're actually, by looking at the flow chart, to see if they're actually doing it.
Okay.
And where we need to improve at,
Right.
you know, where the problem is. Like you said, the 10 minutes going in may be ambitious and we may not be able to get it in, and then I don't see why they wouldn't.
So what would you do to improve it?
Oh, that was the other thing we put. We said that the fast track needed to be open longer. You know, the ones that it's not considered
So-
a non-emergency.
Fast track.
Mm-hmm. Well, what was it, urgent care?
Yeah, urgent care.
That was part of our improvement too.
Fast track and urgent care.
Staffing. More staffing.
Staffing. All right. Let's stop right there though. If we're going to have staffing here, we probably need to analyze it here. Does that make sense? We can't just say we're gonna improve staffing if we don't know if that's the issue. So an example would be maybe looking at time sheets. Seeing how many, you know, when people are clocking in, clocking out, to see what shifts, evaluating our FTEs, to see how many people are working during certain shifts.
I thought that would show under the daily flow charts, analyzing how many.
Well, if that's the case, then we need to specify if this flow chart is for patients or staffing.
Both.
It would be for wait times and staffing. 'Cause how much staff do you already know how many people you have working at the time?
Because then we might find our slack nurses in there too.
All right.
Because their name is on there, and with us tracking, well, this nurse is moving too slow, and this nurse is.
My biggest point here, my
Because
biggest point is that anything you're improving needs to be looked at
Yeah,
first.
yeah.
That's all I want to make sure we're clear on. All right, anything else?
No. Next one's control.
Control.
We're gonna continue that chart.
Um,
We said
So
we
we're
were
gonna continue
the
that chart after
yeah.
that month to see.
The flow chart.
Mhm.
So we're gonna continue the flow chart regardless of the results?
Right.
Okay. Why would you do that?
Because it's something they have to
Maintain.
follow step by step.
So we actually get it.
And what else?
Um,
You may also want to continue the flow chart after a month because in healthcare, a lot of things tend to be seasonal. If you're doing a flow chart in January or February, tell me why it might be different from doing it in July.
It's
It's
summertime, more people outside getting hurt, and different.
Flu season versus.
More people are coming in with runny noses and during, so you want to make sure that your flow chart is accurate and that it's not just indicative of 1 month or a seasonal spike that you may have in volume.
And then probably after some months they get the hang of it.
Yeah, because you have more people at night than you do at day, and vice versa.
And that also depends on regionals. In Florida gets a lot of snowbirds. So when we would look at our data, we would always have to account for the fact that we had higher volume of elderly people during certain months. And because of that, we had to account for that when we were analyzing data. We couldn't necessarily just look at the raw data for what it was worth because it may have been a little, off because of seasonal effects. So seasonal effects might be regional, different areas. It could be based on, like you said, maybe in the summertime, people are outside more, so there's more, fractures and stuff. So you want to also account for those things as well when you're doing tests like this, when you're analyzing stuff. You don't always necessarily want to look at the data for what it's worth. You want to kind of look at the bigger picture too, to make sure that what you're capturing is accurate and not like an outlier or off a little bit because of something like that.
But does the triage nurse really have that much control over the 3-hour wait time? I'm
It
asking.
depends.
It
In
can
general.
bottleneck.
It depends on the hospital, it depends on the volume. In some places, if they are not efficient, it will affect the wait time, because that's the first person they see. So if they're not being efficient and they're doing whatever else, or,
Mhm.
I thought that you guys bringing up supplies was a good thing, because, I actually did a report one time where we analyzed the time that nurses spent looking for things. And we added it up over a week. It was a lot of time that they spent looking for things. So supplies was a good example. When you factor in the time they're out looking for whatever it may be, or where's their cart, and you factor that out over a week or over a month, it can affect the wait time.
And then too, there's some triage nurses that like, when they put in a computer, they slow it, put it in the computer. And you see.
And they may figure something, that you're not, there's nothing wrong with you, and really be something wrong with you.
Right. So they can definitely affect the wait time. Again, because of the mere fact that they're the first people you see. And so if they create that bottleneck right there, everybody else, gets a backflow.
And you can see, like Cape Fear, they know that that's one of their problems, because now they recheck within an hour of your vital signs, because, things change. Like when I went last week, they kept calling people back to recheck their vitals because they had been out in the waiting room so long.
Right.
And things happen like
That's
that.
true.
Your temperature can go up.
Right.
They give you medicine, you can sit there for 5 hours, and it's starting to go back up. It's a whole bunch of changing.
Right.
You pass out while you're out there.
Was that the only one? We kind of got off topic. Was that the only one you have for control?
Yeah, I think so.
Okay. So I was glad to see that both groups chose something differently, so we could see how using more than one acronym, how it might affect what we come out with. But I think for the most part, we both came out with pretty good results. We both were able to start at the top and go down through it to figure out how we're going to analyze the issue. I hope that kind of made what we did on Tuesday a little bit more clear today. And as I said on Tuesday, quality is a major issue. It's becoming even more major as we go through, and people are having less staffing and less money to do things. The ED is always going to be a problem. It's always a wait in most places. EDs are trying to get more efficient by fast tracking. You're starting to see more EDs do things like that to try to cut down on that wait time, because there have been legal issues where people have, died in the waiting room because of the wait, or people's conditions have worsened because they were sitting there waiting so long. So there's a lot of legal implications that can be linked to just sitting out there waiting. And so the more efficient that hospitals can become to cut down this wait time, they're going to have better outcomes, better quality, higher patient satisfaction scores. So quality kind of affects everything throughout the hospital, whether it be something clinical or something more like this that just deals with wait time. So hopefully you got something out of this. I thought that both teams did a good job. Like I said, I'm glad you guys chose different acronyms, so we could kind of see how the scenario would go if you chose a different one. Does anybody have any questions? That was a good question about if it could, if triage
Well, I just
nurses-
usually don't, usually you get into triage fast, especially at Cape Fear. And then you go in the back and they're completely backed up, people sitting in the hallways because of waiting on x-rays. And they're getting
Right.
better at that because they're doing x-rays before you even go to the back.
But I think it was you or someone that said that it could also be that just because a triage nurse has seen you, you don't know what documentation they have to do before that person can move on to the next place. So if the triage nurse is just seeing people but not documenting anything in the computer until 30 minutes later, that could also create a backlog. Yeah.
Well, like at Womack, you can see, 'cause they put the charts right in front of you.
Yeah.
And the doctors come out and pick up, the nurses come out and pick up the charts. But Cape Fear, you're right, and then they have to put it in here.
Yeah. Any other questions? All right, we're done. Done for today. Have a good weekend.
Thank you.